Thank you guys for coming out. 8:30 a.m. comes quick. I know you guys were doing a lot yesterday, so it means a lot to me that you'd wake up early and spend the morning with me talking about overhead position. So as Mike kind of alluded to, I've spent my career in a couple different areas. So I started out in high sports performance. I was a Division I strength coach. And then I had an idea of, hey, maybe I should go back to school for some reason. And I went 3.5 years, got a doctorate in physical therapy, only to go out and take my next coaching job. So over the course of my career, I have never worked as a traditional physical therapist. And that's something that is like news to half the people in the audience, even at my own seminars. But what I have done is taken a lot of the things that I learned in school, trying to transition some of the movement diagnostics and scale them for personal trainers, for strength coaches, so we can actually use movement as our medium for not only optimizing performance, but also trying to enhance the injury prevention model, which we are essentially at the front lines with. So before I get into the actual slides, one thing that just sticks out to me time after time when I talk about the overhead position is the increasing incidence of injury rates at the shoulder. Now, there are emerging statistics right now that the shoulder in the active population, so I define the active population as somebody who has a physical practice, whether they're walking their dogs 4 times a week, whether they're going in and they're powerlifting at elite FTS, whether they're a bodybuilder, whether they're a CrossFitter, whether they're just an average gym goer. That is active population. We are seeing emerging statistics that inside of this active population, the incidence of front-sided generalized chronic shoulder pain and injury is at the levels of chronic lower back pain. So that might come to a shock to you because we've known for 10, 15, 20, 25 years that, hey, back pain is the most prevalent injury or chronic exacerbated position that we could possibly be in. And it's actually not true anymore. So the shoulder is equal, if not more, than the lower back right now amongst the active population. So my mind goes to, are we actually hurting our people more by having them train than people that are sitting on the couch? Statistics would say yes in terms of shoulder pain. So the 3 most intriguing areas for me in terms of injury prevention. Injury prevention doesn't actually exist. There's no 110% injury prevention, but preventing otherwise preventable things in the gym and out. We have the lower back, we have the shoulder, and then we have the knee. But the lower back and shoulder, those are number 1 and 2, and that's really what I'm going to be talking about here at the NSCA now and then at 11:30 with the squat position. So the overhead position starts with the 2 foundational movement patterns, the push and the pull. The push and the pull comprise all of the possible positions that we could put the shoulder through. So we're thinking about horizontal plane of action, we're also thinking about vertical plane of action. For me, it starts off with the clinical, also the movement auditing process around these 6 foundational movement patterns. For the shoulder, I start with the push. The push is one of the most overtrained movement patterns that we have in our industry. Simply put, people like to do things that they can see working in the mirror. It is literally as simple as that. You roll into the gym and you go, man, what should I train today? Look into the mirror, chest, do some bench press, do some curls, maybe some forearms, calves if you're me. We do things that we think are helping us, but I think over a longer period of time, these things are compounding into other problems that we're seeing, especially with our westernized society. You know, we have crazy incidents of postural stress disorders in our populations. Everyone's on the cell phones, everyone's on the computer. Other than being in the gym, we're highly sedentary and really, truly poor positions. And then we go in to train, and things for a longer period of time don't line up well for our long-term health and wellness, nor our performance. I really look at posturing and daily postures as something that does not discriminate whether you are a high-performance athlete, whether you're a mother of 4 looking to lose 20 pounds, or whether you're trying to live out your 70s more pain-free and active. Posture is one of these things that we have to be rebuilding. It's not good enough to say, hey, we just need to stand up straighter. How many times have we heard that before? Oh yeah, let's work our posture by getting into this position. It lasts about 5 seconds and we're back into the other position. So in terms of rebuilding some of these sound positions, especially at the shoulders, I start with training. Training's my medium. Very rarely do I put my hands on anybody. Very rarely do I do anything that would use my scope of practice as a licensed clinician. Movement has become the medium predominantly over the last 2 years, and we've been mixing and matching both of these models over the last 12 years of my career. But the push, the overhead, starts with the horizontal. I save you guys looking at another bald head picture of me, and this is actually my wife going through these movements. She's a good mover. She's way better looking than I am, so you guys can look at her instead of me. What we're going to be going over here are two different things. One is going to be a screening process, and then based off of the screen, we are going to look at more an advanced assessment. Does anyone know the definition and the difference between a screen and an assessment? Yes? That's pretty good. It's pretty good. So I look at a screen as a quick judgment call. It's a yes or it's a no. You got a gun pointed at your head. Are they going to overhead press today or are they not? That is a screen. An assessment is something that when the screen goes awry, when we have a positive screen, we look at the why behind these things happening. We look at the why. So screening is something that happens very, very quickly. It is risk mitigation, very simply put. And then an assessment is the why behind, and the assessment gives us more data points, like you said, that we can actually utilize in order to fine-tune our training, fine-tune our warm-ups, fine-tune our entire management of that athlete. For the upper body push screen, we look at the push-up being the primary thing and the most authentic push pattern that we could possibly do. Now, with the powerlifting culture that I'm very much so in, with the bodybuilding culture that I'm very much so in, it's like everyone forgets that the push-up's actually a thing. We actually have to train the push-up, develop the push-up, load the push-up, scale the push-up in order to actually optimize going into an open kinematic chain on the bench press. We have this polar opposite. But when we screen, we look at the most authentic movement patterns that we can have full body composition with. So we look at the push-up as being the number one screen. I'm going to bring up my buddy, Dr. Jonathan Mike, and we're going to go through some demos. I picked the most jacked dude in the room to try to do these. We'll see how functional he is. If you guys don't know Dr. Mike's a university professor in Arizona. Used to write for Elite FTS, doing amazing things with the NSCA. Good friend of mine. Are you a good pusher-upper?
We'll see. It's 8:40 a.m.
All right, we're going to come front and center here. So when I screen somebody, remember, screening is different if you're doing an FMS, if you're doing standardized screening protocols, or if you're doing quick screens, which is this. A quick screen is something that should happen each and every session. So say you have the push-up or you have the bench press slotted for your key strength indicator lift of a training day. You better be actually looking at the push-up that day in order to screen it out in a warm-up process or to scale it up in order to, again, try to keep away from hurting your clients, stay away from actually pushing load into an exacerbated position. So the push-up is something that I literally just ask people to do. So this in our warm-up, if you guys are familiar with my 6-phase dynamic warm-up sequence, this would happen in phase 5 of the foundational movement pattern development. So simply put, we're going to watch him push up. I'm going to ask you a couple questions, then we're going to go through some criteria. Yep. Cool, and chill out. So without knowing anything, the thing I love about screening is that, how many coaches and personal trainers do we have? Raise your hands. Any clinicians in the room? Okay, cool, we got a cool mix. The thing I love about screening is for personal trainers and strength coaches, we are using movement as the medium for movement diagnostics, meaning that you guys know movement better than anyone in the industry. You know movement better than a physician, better than an osteopath, better than a chiropractor, better than a physical therapist. Sorry guys, as a trainer, you see more movement in a couple year period than some of these other allied healthcare professionals will see in an entire career. Global movement is what you guys are best at. So using global movement as your screening protocols is really, really important. A couple of years ago, I tried to quantify the 10,000 hour rule for a personal trainer. Personal trainer working full-time can gain mastery of watching human movement in only 3.5 years of full-time training. What other profession do we see 10,000 hours of something in only 3.5 years? We are using this as our medium to look at screens. So in terms of the push-up, we had John go down. He went on level ground. He was able to do push-ups. He was able to string at least 3 together. That's what we look at for the push-up screen. We want people to elevate their hands at a 16 to 18-inch elevation off the ground to take strength out of the equation, because when we're screening something, we don't want strength to be the limiting factor of somebody's functionality. So for a weaker athlete or somebody coming off of a rehab protocol, we may do hands elevated push-up screen off a traditional weight bench. We do not do kneeling push-ups because, in my opinion, we don't get a really great look at the entire kinematic chain working in unison as a whole. We kind of kink the chain at the knees, and the stabilization of the pelvis and the lumbar spine coordinating with the rest of the pillar gets altered a tiny bit. So it's not a great scale if you plan on training the movement itself. But when we're looking at any screen, so this could go for the push-up, this could go for the overhead position, this could go for the squat, as we're going to talk about later on today. We're looking at 2 key things. This is so simple. Remember, a screen happens in a couple seconds. First thing that we look at is spinal positioning. We want to maintain neutral-ish spinal positioning. There's no such thing as perfect spinal neutral. We have natural curvatures that happen. What I'm thinking about with neutral-ish spinal positioning is we don't have any red flag fulcruming signs, meaning that we don't have any huge amounts of range of motion coming from one segment to 3 segments more than all of the rest. So that could happen at the C-spine, the T-spine, the L-spine, down in the TL junction. It could happen anywhere. So use your eyes, and usually from a push-up position, the way that we look at it is from the side. So let's look at that. Let's go 2 reps. Cool. So if I were to be super nitpicky, would you guys train push-up today for him? Yes or no? Would you go, yeah, I'm going to train the push-up, or no, I'm not going to train the push-up? Yes. The reason being is neutral spinal position happened first. The second thing that we think about in screens, we're only thinking about 2 things here. This is not an assessment, it's a screen, is unwanted rotary forces happening at anywhere on the body, taking a precedent over unilateral unwanted rotary forces. Let's look at 2 more push-ups. So that would mean we had rotation happening at the shoulders, compensation is happening from the hips, spine. It could happen from anywhere. So we're looking globally here. At that point in time, we've opened up our abilities to go in and train the push-up. Cool, let's hop up. Are you sweating yet? That was a yes. So if you guys aren't familiar with the functional movement screen, great screen. If you guys aren't using their shoulder mobility test, the reciprocating internal-external functional test, start using it. It is an unbelievable test that can show so much. I'm not going to go over it. I'm going to give FMS the credit where credit's due here, but this is something that is pivotal in my screening of the shoulder as well. So we need to, before we go into an advanced assessment of the shoulder, we need to have an appreciation for the shoulder not just being this ball and socket joint right here. This is 1 out of the 4 synergistic joints that comprise the shoulder complex. And honestly, this is the joint that we have to do the least amount of work on because it is the single most inherently mobile joint in the entire human body. So the other ones, we're thinking about the AC joint, the acromioclavicular, we have the sternoclavicular, we have the scapulothoracic joint. All these things have to be working in unison in order, again, to mitigate the risk of chronic front-sided or even acute shoulder pain and injuries. So looking at just this is something that I see so common in the industry. This hurts. You know what? Maybe 70% plus of people are going to have this hurt right now. This hurts. That doesn't mean that we should put a kettlebell in it and smash it. It doesn't mean that we should stretch it out on end range. It doesn't mean that we should wrap bands around only this part. It doesn't mean that we need to retrain only this. It's a complex. And more than that, we need to be looking more holistically at the entire body here. In my career, I've had the most success treating number 4 with more respect. The scapulothoracic joint, for me, unlocks the potential for pain-free performance on the front side of the body, more so than any of these other joints. It would be negligent not to talk about static shoulder posturing before we actually get into the assessments here. This is a quick slide to show true perfect posture, which is a mythical beast. It doesn't exist. People are not symmetrical like this photo. People are not pain-free. People are not functional. 90+% of the population is going to deal with a dysfunctional or pain issue this year. So saying that somebody has to look like this scale isn't really practical. And honestly, shoulder positioning, shoulder posturing is the last thing that I look at from a static position. But we're just thinking about what something should be able to move back to in terms of better neutrality. So the best photo that I could show here is going down through full body. So we have the midline of the ear, we have the acromion, we have the greater trochanter, we have different aspects of each and every part of these joints. You know, we have the fibular head here. It comes all the way down to the navicular. That is perfect posture. That's what we're trying to move back to, knowing very well that we're never going to be able to find the truest posture that would be perfection. So we can also look at the scaps. The scaps allow us to look at different angles, different positions, because the scaps are usually going to be the medium that we use in order to optimize, to try to use movement as our medicine to get people out of those front-sided shoulder pain positions. John, can I grab you again? So let's face this way. So when we think about the scapulas, oh, these are some good scaps. Amazing. So we have different aspects of the scapula. You think about these two different triangles on his back. So the medial scapular borders, these are these things. When we're looking at things from a static position, we want these two to be somewhat parallel. So within 10 degrees is usually what I look at. In terms of the superior angle of the scapula, that is this angle right here. We want it to be at a spinal level of about T2. If you guys can count down, T1, T2, it's within half of a level there. That's the next one. The spine of the scapula is at T4. This is this big bone that comes out of the side. That comes around, T4. All of these things are well and good on somebody that is lifting, somebody that is healthy. If we fake this one, this is what people usually come in at. Something like this, and all these things are altered. So in terms of trying to optimize shoulder positioning, in terms of getting somebody out of a front-sided shoulder pain exacerbating position in the gym, we need to start here because we need to know where these shoulder blades need to go. There's 17 muscles that intricately connect into the scap. All of these muscles have attachment points down into the shoulder, up into the C-spine, into the T-spine, all the way down into the oblique slings. So this is a complex area, but we need to know which way to actually manipulate these positions in order to get better recruitment, better dynamic stability and activation through this area. So assessing the overhead position, I think for personal trainers and strength coaches, it needs to be said that we have the scope of practice to look at ranges of motion. We have the scope of practice to look at movement in any different angle or position. What we're not doing here is diagnosing medically. This is very, very important because as world-class personal trainers and strength coaches, we really need to toe the line between what is within our scope of practice and what is without it. So in terms of medical diagnosis, we have no role in the industry, which is totally fine because medicine and fixes of pain, marked dysfunction, and having a medical-based diagnosis is out of our scope of practice. But using a movement-based diagnosis as a movement practitioner, which is what we are, that's where we get in, and we need to be actually yielding better information, better data points based off of using movement. So the way I look at movement is being able to assess simple things like active shoulder range of motion, moving into degrees of flexion, moving into degrees of scaption, abduction, extension, abduction, all these different angles. If you guys are having trouble getting people into positions, having trouble being able to optimally place people in sound positions to train, not only pain-free, but something that could be scaled up for loading, we need to be looking at things a little bit more isolative. So yes, we start off with global patterns as we just showed with the push-up, but then we move on from there and we have to be looking at other things in order to, again, gain more data points. So in terms of assessment is only necessary if, again, we cannot pass these screens and feel good about actually loading some of the movement patterns that we fall into. So range of motion is important, but in terms of using movement as your medium, I look at the scapulohumeral rhythm as being one of the single most important things, especially in getting up into an overhead position. So scapulohumeral rhythm, it can get very, very technical, very quickly. But what we need to know are the simple things that we can utilize in terms of trying to systemize our foam rolling better, systemize our stretching, our mobility drills, systemize in a way that we can have better pain-free programming. So let's turn this way. So as the shoulder elevates, so let's go up like this. As the shoulder elevates, we have all four of those joints in play, doing different things at different times. Come back down. But thinking about just using a flexion, a couple key things happen. We have movement from the shoulder blade happening. Let's turn you this way too. We have movement from the shoulder blade happening, and we also have movement from the glenohumeral joint predominantly. Come back down. The shoulder blade moves in 6 planes of motion. We have elevation, we have depression, we have protraction, we have retraction. Most importantly, we have upward and downward rotation. One of my biggest pet peeves in terms of trying to get people in and train more pain-free and have more of like a prehab, rehab style of warm-up is that we do all of this isolation work that only happens in retraction. It only happens in depression. The kind of row that is like doing one of these things, instead of actually looking at the shoulder blade with all of these different muscles dynamically stabilizing around it to get them to do their jobs, which is, again, dynamic stability. Dynamic stability happens within oblique planes of motion that happen in and out of all 6 of these cardinal planes. So we think about trying to optimize and adding these movements together. That is where we're going to have the biggest amount of success. So knowing very well that we have degrees of protraction plus elevation plus upward rotation happening as we get to terminal end ranges of overhead range of motion, we're trying to put a little bit of a metric on it in terms of, hey, is the shoulder blade working the way that we want it to, or is this something that we need to start to re-educate? So let's turn all the way this way. So I'm going to ride John's shoulder blade up as he goes and elevates up slowly. Come right up in front of you. Come back down. So what we want to happen here is at about 90 degrees, so put your arm out at about 90 degrees this way. So at 90 degrees, not much should be happening here at the shoulder blade. From about 0 up to about 20 degrees, this is all rotator cuff unlocking the centrated moment at the shoulder. After about 20 degrees up to 90 degrees, this should be predominantly happening from the glenohumeral joint. After 90 degrees here, maybe up to 160, 170, 180 degrees, the unlocking mechanism needs to be happening here from the shoulder blade, moving up into upward rotation, elevation, and protraction together. More importantly, in terms of controlling the eccentric moment of this, we have to be able to reverse this as this arm goes down, controlling through those ranges of motion again. Now, what I use with my trainers and what I use with my athletes is very simple. At 90 degrees, does the shoulder blade move? Yes or no? If it's already pre-rotating here at 20 degrees, at 30 degrees, at 40 degrees, we know that we have some issues that we want to start to look in and try to correct. If we're at 90 degrees and nothing's happening at the shoulder blade, awesome. The next thing that we're really looking at is the ability to get up through a full terminal end range of motion overhead to try to get into a position that we'd possibly train from. Now, you guys will have these slides. This gets very, very technical, but there's different things that happen at the humerus, the scap, the clavicle, all in conjunction together in different phases of scapulohumeral range of motion. I'm not in the business of teaching you guys things that you could look at a textbook and see. Like, okay, I can look up scapulohumeral rhythm in a textbook. The things that I use are the things that can scale very, very quickly. They're things that I can look at and I can make a yes or no decision based on what I want to do next. So in terms of scapulohumeral rhythm, 90 degrees is key. Overhead position is key. Being able to look at those two things in the way that the shoulder blade is articulating, that is really the most important point, because everyone's a special little snowflake. Everyone's going to be a little bit different, as we're going to talk about in a couple slides here, especially with the shoulder anthropometrics, the size, the shape of the scapula. There's so many different unique properties here. We can't just look at one thing and think that everyone's going to be at 90 degrees, everyone's going to be at 120 degrees, the clavicle is going to rotate 5 degrees when we hit 140. That's just not going to happen. We need to look at generalities and commonalities between people that we can scale up quickly. Again, the goal is to train. The goal is not to do this stuff. If I never had to do another scapulohumeral assessment in my career, it would be a good day, because you know what? People would be doing loaded push-ups. They'd be doing bench press. They'd be eliciting a training effect. Again, the goal is not to fix. The goal is not to assess all session. The goal is not to make the session a warm-up. The goal is to actually train. So having that mindset is really, really important when we are talking about assessments. So advanced pushing assessment. Push-ups for me, bench press for me, working with some of the strongest people in the world, some of those beat-up meatheads in the world, there's nothing like trying to rebuild somebody's bench press that literally have 2 degrees of range of motion this way, 4 degrees of range of motion this way, have 0 T-spine extension, literally have the most exacerbating past medical history that you've ever seen. The most effective thing for me in my career on getting people that should not be bench pressing to actually bench press 4, 5, 6, 700 pounds in competition is to find something called shoulder centration. Shoulder centration is an interesting thing, because very quickly, if we can find this one point with the shoulder, the glenohumeral joint, the humeral head coming into the glenoid fossa, finding a centrated moment where we have maximal surface area contact at these two bony prominences, good things happen very, very quickly. Maximal surface area at these joints, it allows us to have inherent stability as deep as possible on the human body. When we have humeral head plus glenoid in the perfect position, it allows us to neurologically link up some very, very intriguing things. At the deepest of levels, it allows the rotator cuff complex to actually do its job, which is dynamic stability and unlocking mechanisms happening at the glenohumeral joint. Outside from there, it allows our primary stabilizers, muscular stabilizers, to be in an optimal length-tension relationship, again, to grade static stability. Even more broad from there, it looks at our secondary stabilizers, things like the pecs and the lats, to actually do their jobs with dynamic stability through altering positions of the shoulder complex itself. Shoulder centration is a magical, magical beast. And finding a centrated moment has allowed me to, anyone follow the Dave Tate project? Okay, cool. So Dave literally is the most beat up human being in the world. You know what? We have Dave bench pressing pain-free 2 times a week for the last 8 months. He has 2 degrees of internal, 5 degrees of external. He needs a shoulder replacement. He's not going to get one because he's a banged up meathead who wants to do what he wants to do. But we got him in a position where he can actually optimally train. There is a very, very little window of where this dude could get his shoulders in order to actually press a barbell pain-free. If you can find it on him, you can find it on anybody. So what it comes down to here with shoulder centration, trying to scale up for the pressing pattern, is looking at something called the shoulder scour test. Shoulder scour test is all about trying to optimize centration through the optimal humeral carrying angle. So we think about a humeral carrying angle as being this angle right here. So we have the humerus, we have the midline of the body, and this angle for most people is going to be between 40 and 60 degrees in 80% of the population. So we think of an angle of 40 up to 60. When I teach, when I assess, I go at halfway down at a 90 at 45 degrees, and that is our starting point for people. Especially with the bench press, especially with the push-up, I see two different types of movements that are truly faulty movements and mismatches based on the shoulder typing that we're seeing. Can we come back down? You're gonna do like a yoga push-up. Like you're gonna like get your elbows right in, you're gonna push up. So we have a very low carrying angle on this example. Yeah, so go down, come back up. I want those elbows touching the side. Yeah, that way. So I see something like this a lot. I see it with functional strength coaches. Hey, I'm so functional right now. You know what? I don't want the elbows out here. I don't want too much front-sided shoulder stress. Instead of going here, I'm going to go polar opposite. I'm going to get the elbows down to the side. I'm going to go here. I also see this in Pilates and yoga population that's their functional move, which is totally fine. But when scaling for strength, we are not in a centrated moment here. The second position that I see, let's go here and push up. I see this with my bodybuilders, my physique athletes. He can't even do it. Even flare him more. Does that feel like when you do it? Okay, I see this a lot. I see that a lot. So that is the old bodybuilder, the old power lifter. Hey, I need to get the pecs through a stretch, bro. I need to stretch the pecs so I can get more muscular hypertrophy, so I can look in the mirror and I can get a bigger chest and I can feel good about my ego and myself. I see that a lot. So I see this, I see this. I rarely see people actually finding the proper position in terms of their humeral carrying angle and shoulder centration. But again, if you want to scale strength for the long term, if you want to optimize performance, if you want to stay healthy, we need to be in our perfect positions, not the perfect position, because it's going to be different for everybody. We need to find our clients and our athletes' perfect position to perform, no matter the joint in the body. So when we're talking about the humeral carrying angle, the shoulder scour test is one of the best tests that we can possibly do. Let's flip over, you're going to lay on your back. So clinicians, you guys would have a table, you could be able to do this. Trainers, the table's not always available. I do it on the ground with my athletes in the gym. Basically what we're looking at here is trying to get into an optimal humeral carrying angle based off of degrees of internal and external rotation, but also elevation. So this is going to mirror the position that I want to press from here, I want to pull from here, and also the way I want to press and pull from here. The shoulder doesn't know whether you're deadlifting, whether you're bench pressing, whether you're doing a flow. It does not know. All it knows is its most stable moment, and that is shoulder centration. So we do a similar test for the hips that we're going to go over later on today. But the advantage that we have of the shoulder over the hip is we don't have a technical muscle called the It's huge. It is thick. It actually covers some of the big bony prominences that happen in the hip. Even with somebody as jacked as Dr. Mike here, you know, I can easily get in and I can palpate the head of his humerus so easily. So I usually use two fingers here. Let me come over on this side. We have a majority of the people over here. I use my two fingers and I just get an appreciation for the humeral head. If you guys want to palpate it on yourself, you can go up to this bony prominence called the acromion. Come down and then you have a ridge, and then under that ridge you have this soft tissue area. It's like you could kind of press into it, and then down from there you simply feel the humeral head. The humeral head is going to be about this big for people. So we're going to get one finger on anterior portion, one finger on posterior portion. If you guys move your arms through internal and external rotation, we can feel the slide glide mechanism happen anterior or posterior as we externally rotate or as we internally rotate. As we internally rotate, it pushes back. As we externally rotate, it pushes forward. So we can feel the kinematics happening at the joint level there. So the key here is that I'm not manipulating tissue. I'm not having the intent of getting my hands on him in manipulation. That is out of the scope of practice for a personal trainer. But being able to use tactile cues to be able to cue positions, that is well within it. So when I put my hands on somebody, we have to know very well our intent with it. So what we're doing here is allowing the arm to move up and down. So I'm just going to ask you to kind of like move with me. So I'm not manipulating this position, but he's moving with me and helping me here. And then relax it. Then I'm going to find the position where optimally I feel like It's not forward on the joint. It's not backward on the joint. It is right there. And usually it's going to be, again, about 40 to 60 degrees. If we look at Dr. Mike here, he's up at about 60, 65 degrees. He was in a pretty good position because, again, he's training at a high level, but people are going to be a huge mismatch in terms of going in and trying to scale their loading. So the goal would be here is to find this position, to scale this position back up into the push-up. So when we go through some of these assessments, I realize some of you guys have never gone through a range of motion assessment, never gone through something like a shoulder scour test. That is totally fine, but what I don't want you guys to do is go in on Monday and every single client gets a shoulder scour test. That is not the way to use new skills. I don't care where you're learning from this weekend, any of these different lecture halls with world-class people. Guys, use the stuff on yourself first, be comfortable with it, use it on your colleagues, and then use it on your trusted clients before you large scale this stuff in. Because it takes a while, it takes multiple bodies to be able to feel what you're feeling for. There's a reason that rehab pros at this point in time get doctorates. We spend a ton of time in practicals with our lab partner, feeling their bodies, feeling cadavers, doing things like that. But that doesn't mean that we can't scale up as personal trainers and strength coaches our skills of assessment. So when we're looking at that shoulder scour test, obviously we do it bilaterally. I'll save you guys some time here, but then we'd flip it back over. So let's flip over and we try to scale it back up and through. So let's get into a quadruped position. So we always try to scale for position first. Biomechanical positions need to be achieved first, and then we coach for neural dynamics around those positions in order to recruit, to restabilize dynamically and statically. So this quadruped position is where I start people from in terms of trying to get their shoulder patterns right. I try to always cue pillar complex, shoulders, hips, core integrating as a functional unit. The way I like to cue this is co-contraction, pecs, lats here, using a radiation effect of the hands into the ground, glutes, adductors squeeze, core squeezes, one leg comes out at a time, keeping everything else. So extend here. Nope, just extend out into like a push-up position. Just put your foot back. Good, now go from here. So you can tell, even with John's push-up, he's falling into too low of a humeral carrying angle. Too low of a humeral carrying angle, we have increased amounts of internal rotation, elevation. We're actually losing the C-spine position. If I were to be really, really nitpicky, this is the position that I try to fix. Let's go back down here. What I don't want to be is like, hey, let's move the elbow from here to here and push up. I want to actually use what we have in terms of our dynamic stability and our positioning with the pecs and the lats to position it automatically, internal to get an external yield. Okay, so I want you to squeeze harder at the hands here. I want you to squeeze here, I want you to squeeze here. Come back. I want you to keep this, and I want you to pull yourself down into the position. Good. Back up. Good, that's looking a little bit better. So we would be able to coach this, knowing very well that, again, optimal would be 65 for him. Right now he's at about 45. We would be working into that, and there's different ways that we could go in and try to optimize those, whether it be a 6-phase dynamic warm-up sequence, whether it be a mobility drill. There's many, many different options here. Now, when we try to correct, the biggest thing that I like to do is try to use movement as our correction. Use training as our injury prevention. Use movement as the medium, which will optimally fix us. There's no fixing happening. There's just better degrees of movement patterns. So we can alter shoulder positioning, hand positioning, pillar positioning, be able to alter the ground contact, elevate his hands up. There's many, many different ways to reverse engineer this. This is the most important slide that I want you guys to take away. Everything happening at the front side of the shoulder here, everything that is happening, it's a complex beast. The most effective thing that I've done in my career is manage our training economy in terms of the volumes that we're placing through front side or back side of the body in terms of pushing and pulling ratios. When I started my career 12 years ago, yeah, cool. When I started my career 12 years ago, I thought I was progressive. The coach that I was working under at University of Buffalo, great coach, you guys would know his name if I said it, he was progressive. 2-to-1 pulling to pushing ratios. At the time, 12 years ago, everything was 1-to-1, 1-to-1, 1-to-1. Every push, we get a pull. 1-to-1 ratios was gold standard for 30 plus years in the industry. I started out my career 2-to-1. 2-to-1 used to be like shooting fish in a barrel. Hey, somebody's coming in at a 1-to-1, he has chronic front-sided shoulder pain. Boom, let's manage his training economy a little bit better. Let's throw a 2-to-1 ratio on him. More times than not, that was the fix. But you know what? A couple of years ago, about 2.5 years ago, my clients weren't having the type of success that I've had in the past. It's not like I was going out and like blowing people's rotator cuffs out in the gym, but it wasn't as easy as it once was. It wasn't, hey, I know I can change this guy's ratios up, I can optimize the movements, I can coach for the execution, and I can get a good result. There's people falling through the cracks more and more and more. And I look at my own household, and I see my 8-year-old daughter with her iPhone, like this, an hour a day. I see her on the computer now. And I'm like, man, this has changed in our society. You know, an 8-year-old having a cell phone, that's a totally different story. That's a different conversation for me as a parent. But what I see is that people are just coming in more need to reverse the postural positions that they're in on a daily basis. You know, when I worked in pro sport, when I worked in Olympic sport, you know what? Those guys were on the phone even more than my kids are. They're on the computers more. They're in flights more. Oh, that's not good. They're everywhere in these poor positions. So you know what? I had conversations with a lot of my colleagues 2.5 years ago, and we decided to go up to a 3-to-1 ratio. 3-to-1 ratio means for every single rep that you do of a push, a push, a push, a push, a push, we get 3 reps of pulling across the board. This means it is a rep for rep. It means your prehab. It means your rehab, your training, your maintenance. Every single rep counts. It's where people fall off. Every rep counts. In terms of motor control, motor recruitment up here, trying to repattern these positions, we're trying to repattern the brain. So every single rep counts equally. 400-pound bench press is equal to a blue banded pull apart or a face pull. 3 times as much pulling as pushing. And to take that one step further, we've been doing 2 times as much horizontal as vertical pulling over the last 18 months with my clients. We have interesting data pools because I'm in a unique opportunity to beta test 10,000 people at a time with some of these methods. 10,000 people in specific programming will get programming that reflects these ratios. And then we go through and we actually look at what's working, what's not. It's a very unique opportunity to actually go in and get quick data in terms of 8, 12 weeks at a time. Horizontal and vertical pulling. So for every horizontal, we are doing 2 of that for every vertical pull. The reason being is the arthrokinematics at the shoulder joint in terms of pulling is very different than pushing. Pushing is internally rotated dominant. So whether you push in this position, push in this position, the concentric is going to have an internal rotation moment. We can actually manage the horizontal pull a little bit better than we can the vertical pull because we can maintain shoulder neutrality, not into internal, and we can even cue external rotation very, very uniquely at this point to, again, build into the externally rotated posterior chain dominant volume here. Now, this is something that we have across the board with many of the coaches that we work with. We have over 100 gyms with their client management and group training using these ratios, and I've seen a great amount of injury reduction at the shoulders simply using these ratios. Now, this has been something that I've been talking about for years at this point, but it all kind of came to a head with this chart because bodybuilding.com, they said it better than I ever could with one simple chart. And this thing went viral. It got shared over 200,000 times in a single day when it actually came out. And this simplifies the concept. 3 times as much pulling as presses, 2 times as much rowing reps as vertical pulls, knowing very well that vertical pull could be something like a push-up, a lat pull-down, or something like a high row. When we're managing the push pattern. This is something to keep in mind, guys. The push pattern pyramid starts with the push-up. It does not start with the bench press. The push-up is the most authentic pushing pattern because we have double closed kinematic chains allowing our shoulder blades to move under dynamic stability. That is so pivotal and important. We must earn the right to turn our bodies around, get into a bench press open chain position, and then scale up the bench press from there. The flat barbell bench press in the horizontal push pattern is the apex of here. But you know what? This is not for everybody, and that's totally fine. We always try to recommend to train the hardest pattern, the most challenging pattern that you can execute well and pain-free. As simple as that. Pain-free training tenet. Once we've made it to the point where we can go into an open chain with the horizontal, that's when we look at the vertical push pattern. Unless you're a CrossFit athlete that I work with, unless you're an Olympic lifter, I do not program a ton of overhead pressing bilaterally with a barbell because people simply aren't able to get into sound positions to do it with the type of training time that I have with them. So keeping that in mind, there's different ways to train the vertical pattern more pain-free. We can go unilateral, we can use foundational movements, we can use developmental sequences. There's many ways, but as soon as you take a pattern away from someone, you cannot just put them into rehab purgatory and tell them to go foam roll when everyone else does it. What you need to be doing is having a +1 for every -1 that you give. So you need to have a remediation strategy if you are going to take a foundational pattern away for any point in time. It's not good enough to say not to do something. We always have to have a remediation strategy of how we'd optimize. So again, closed kinematic chain pushing work needs to happen before open chain. Open chain must be mastered before we get into overhead. Many of my athletes, again, never get past this open chain pushing work at multiple angles on a bench press variation. That's totally fine. Unless you're a sport-specific athlete that needs those sport-specific positions with a barbell in your hand, there's a way to train more effectively around it. Because if you can't get into the position, the last thing that we want to do is load those positions. All right, guys, thank you so much. I will be at 11:30 again talking about the squat pattern, the quadrant testing, and the hip anthropometrics. So hope you guys see you there. Thank you so much.